Hello, everyone. It is my absolute pleasure and joy and honor to host our guest, who is very well known to the community of multiple sclerosis, very well known to the World Federation Neurology community also. This is World Brain Day team. This is World Federation Neurology social media team, and I'm talking on behalf of YouTube channel of ours also. Professor Gavin Giovannoni, I used to call him as Gavin. Gavin has visited us at Western Health Melbourne a long time ago, pre-COVID normal days. He gave us a brilliant talk at that time, and we fondly remember how he entertained our crowd. But today I'm going to start with a different question. I'm going to ask from Gavin his own life journey. How did Gavin was baked from your very early high school days or primary school days to medicine to MS world and academic world and brain health? Take us through the journey.
Okay, so just to say, my surname Giovannoni is Italian. So I grew up in South Africa, and my dad was a second generation Italian. So his parents were from Italy, and my mom was a second generation English woman, and her parents are from the UK. So I'm a typical colonialist in the sense that lots of immigrants in South Africa, and that's how I was made. I was very interested in zoology, just when I was I had intentions of studying zoology, but then my dad got chronic renal failure. So he actually presented with malignant hypertension and was found to be in chronic renal failure and had to go on dialysis literally within about 6 weeks of being diagnosed. And he went on to peritoneal, eventually went on to home hemodialysis, and then he had a transplant 12 years later. He was clever enough, my father, actually, to notice that in the transplant clinic, everybody was cushingoid because he was actually living in the era before cyclosporin, and people were on very high dose steroids and azathioprine, essentially. And he didn't like the look of being cushingoid. So he actually delayed going on the transplant list until he saw, after cyclosporin arrived, their body habitus changing. So, but anyway, the important thing is I got exposed to medicine when my dad started dialyzing, and I got interested in it, and I changed my career choice from doing zoology to becoming a doctor.
I think that's what, at that time, Gavin.
So my dad was diagnosed with chronic renal failure when I was 12. Mm-hmm. Yeah, and I probably changed my decision to do medicine around about 15, 16, and apply to med school. I think that the experience of being exposed to ill health, and I got exposed to the hospitals and everything, that's probably what made me want to do medicine, because I didn't have anybody in my family that was in the medical field. Now, what's interesting is when my dad, and this is a message I always talk about brain health, is when my dad actually presented to the nephrologist, he had these tiny shrunken end-stage kidneys, and the nephrologist said to him, look, it's pointless me doing anything now. I can only replace your kidney function by putting you on dialysis. I wish I'd got you earlier. We could have prevented it. And I think that's the message. My father did actually have a history of intermittent hematuria when he was a teenager and in his early 20s, particularly after exercise. And he was never investigated properly by his family doctor for that. And I suspect that if they had investigated him earlier, they would have picked up that he almost certainly had IgA nephropathy by the sounds of things. And, you potentially could have immune interventions or whatever prevented him having renal failure. And I think that's the message I have now in MS, with multiple sclerosis, which I work on. We have a sentinel event. People come to us with their first clinical event with a relatively healthy central nervous system or brain. So we have the opportunity of managing them effectively up front to protect that end organ, that brain. Whereas in other conditions, like my father, you can just replace it. Type 1 diabetes, they present when they've lost the end organ, they've lost the islet cells in the pancreas that make into insulin. So, we are kind of fortunate in neurology that with our main autoimmune disease, we do get an opportunity to diagnose it relatively early and prevent damage. And I think we've got to think about our therapies as preventing damage. Anyway, I went to med school. in Johannesburg, the University of Witwatersrand is where I studied. I got exposed to lots of different things. I decided very early I didn't want to be a surgeon. I just didn't like the hanging around and waiting. So I was always on the physician medical side. And I had a choice between hematology, where I was exposed to very inspiring hematology lecturers and professors. But I think what made me want to do neurology is actually I had a brilliant neurology teacher. His name is Dr. Charles Kaplan. He moved to London. He's actually a neurologist in London now. And he was such an inspiring teacher that, he made me want to do neurology. And it was also one of those things, the brain is this black box and it's interesting and it's a frontier. And I think that all those things are the kind of things that made me want to do neurology. Getting into MS, well, one of the first patients I ever clerked as a medical student in fourth year was a woman with MS. I spent an hour and a half with her, and it was really, the whole fascination. It was like, God, this is a disease that needs to be sorted out. We need to study this disease. And what's interesting is that she didn't tell me, but at the very end, she broke down in tears and said that her son was in my class. Her son's name was Warren. And she said to me, Dad, I don't know Warren. I said, I knew him, but I wasn't friendly with him. Anyway, she then came out with all these anxieties about, she wanted to be able to be walking when he got married, attend his graduation ceremony, etc. The tragedy is when I saw at the graduation ceremony, she was using a walking stick. And then about 4 or 5 years later, when I was a registrar in neurology, studying trainee, she was in a wheelchair. So, I'd watched this lady from being a medical student to graduate, a fourth year medical student to final year medical student to becoming a trainee. I'd watched her gone from being mobile to a walking stick to a wheelchair. So I got that early on in my career. And then what happened was after I had done my internal medicine and then my neurology training, we had a visitor from the UK. John Newsom Davis was a visitor. I went with him and his wife to one of the game farms, and he offered me a research position in Oxford. However, I applied to a lot of other places, and because my wife was working in an advertising agency, and her advertising agency had agreed to transfer her to the London office, it made sense for me to take up an offer I had at Queen Square. And that's why I ended up at Queen Square doing multiple sclerosis, rather than at Oxford studying because the research project that John Newsom Davis offered me was in myasthenia gravis. So, there's all these little things happen, but I had offers to go to Philadelphia, one in Chicago, one in New York as well. So I had a whole lot of research opportunities to take up, but I chose London. And that's where I am. I'm still in London, and this is now 30 years later. And I've been doing MS since I arrived in 1993. So it's close to 30 years doing multiple sclerosis from a research perspective.
Life is a funny thing, Gavin, isn't it? While you have plans for life seems to have other plans for you.
Yep, that's true.
It's like so. It is clear that why you wanted to become an ardent brain health advocate and wanting to get in early and treat early, which you are very vocal when you were visiting our institution a few years back, also on the same theme. And I'm aware that you have a huge fan base globally in social media, also on the same theme, including your blog or the writing in blogs. And it is indeed correct to say that not only multiple sclerosis, many brain disorders that are the leading cause of disability globally at this point of time, and second leading cause of death, that the multiple sclerosis, of course, the queen of neurology, if you like, it is the forefront of everything else. So you wouldn't be surprised to see that we came up with the idea of stroke multiple sclerosis for the World Brain Day theme, as you could almost stop by getting early and treating early. My next question is, how excited are you as an ardent promoter or supporter of brain health in MS to see World Federation Neurology, which is a massive organization, is partnering with the Multiple Sclerosis International Federation to advocate on brain health throughout the slightly protracted World Brain Day campaign beyond 22nd of July until it trims over 3 months, trying our best to surpass well over 100 million, 160 million people worldwide talking about brain health, talking about stopping multiple sclerosis, addressing those issues that are disturbing both you and me, the access to treatment, access to early diagnosis, access to education, the lack of equity, so on and so forth. How excited are you to see such a campaign be happening globally?
No, no, extremely excited because, it's all about activating the community to take this opportunity we have, and we have a wonderful opportunity to make an enormous difference to the field. And the term stop could be interpreted in different ways. Doesn't really matter. It means the same thing. We want to get people who've got multiple sclerosis. And this is our ambition of our brain health project, is to get people with MS, when you typically diagnosed in your 20s and 30s, to get them to old age with a healthy brain as possible. And so they can age normally and experience old age like normal people. And that's kind of our target. I mean, the reason why we started the Brain Health Initiative was simply because there was such variability across the world, and also not only in the world, within countries and even within regions, about how people were managing MS. And, so there's this thing called a postcode lottery. Depending where you go, you're going to get managed differently. Some people would have to wait until they became disabled, for example. I mean, quite recently, New Zealand had that policy. You had to be disabled, EDSS 2, before you got onto a DMT. Thankfully, they've stopped that now. So the whole idea was, can we create a policy initiative to activate the MS community, not to think about treating MS when people are disabled, but to treat MS much more effectively upfront when the brain is still healthy and protected. And that's kind of the aim. And that's why we've tried to steal from stroke time is brain. It is, it may not be seconds and minutes what happens in stroke, but I personally think it's days, weeks, and months in MS. I've got lots of examples where anecdotes. These are patients of mine where we delays for various reasons that aren't long delays. There may be weeks to months where catastrophic relapses have really left those patients very disabled. So they're rare, they're not common, those stories, but you just got to be aware that if you wait too long with MS, it's like any brain disease, you're losing brain. And unfortunately, we don't have therapies that reverse the damage. People think, oh, we're going to have a treatment that's going to restore brain function. Well, yes, we may get there in the future, but at the moment it's science fiction. We don't have neurorestorative therapies where I can repair a damaged MS brain. What we can do is protect and prevent MS brain from being damaged by our effective therapies. And that's why the whole thing's about time. How do we get people diagnosed as early as possible? How do we get them onto treatment as early as possible? If they're not responding, can we get them onto more effective therapies? Or if they've got a bad prognostic profile, give them the most effective therapies straight away. It's just about being proactive and also engaging in the individuals, because people with MS need to understand what we're trying to do for them. And if they understand what we're trying to do for them, they buy into it, they understand the treatment philosophy, and we are making a difference. I mean, you've seen the natural history data. It's changed dramatically. The chances now of becoming secondary progressive, the average time to secondary progressive, depending which study you looked at, was around about 15 years. We're pushing that way out now, and even some people may never become secondary progressive. But that's what I wouldn't be surprised if a big chunk of our patient population who are being treated effectively now won't ever become secondary progressive, because we've got the disease under control. That's the aim.
You touched upon a couple of key points. Indeed, I was trained in New Zealand, so I am well aware of what you just mentioned. I remember vividly staying on the phone those days, talking to the authority, sort of faxing like 20, 30 pages worth documents, waiting until EDS is hit to get very basic medications such as interferon doses. I'm glad that it's gone out of the window. And the second thing that you just mentioned, I can share an anecdote recently. While I was on ward duties for the weekend, I had to spend like 3 hours on a very sort of malignant MS case, sort of very unfortunate sort of mid-20s young lady who actually had access to 3 different neurologists during last 3 months. But for some reason, this is not a criticism against those neurologists or the family, but somehow the patient and the family felt that it can't be MS because she is walking and talking and there's nothing visible as per disability. But MRI scan, when you look at the images, you could see that the brain is pretty active. And the neurologists were keen to treat her with DNT, but somehow the communication breakdown occurred until she came in with seizures and sort of massive flare, which probably caused a reasonable amount of brain damage already, unfortunately, by that time. So it basically, the points that you just mentioned, well taken with that. And the other important thing is, you may recall the recent publication in Nature Review Neurology about talking about this prodromal phase of multiple sclerosis, which I was kind of observing in most other neurological disorders last year as we were dealing with a whole lot of COVID-19 cases. I know this is fairly hypothetical, even in disorders like stroke, before the catastrophic event occur, the underlying immune inflammatory activity is probably building up over a number of months, giving us an opportunity to intervene and preserve and protect brain function as early as possible. So hopefully, the MS World and Brain Health Initiative, such programs, would enlighten us more so that we can maintain brain health better. And the other important thing to mention is what you just mentioned about the importance of brain health. If you go back to the original definition of health by World Health Organization, I think, if I remember correctly, they did it in 1948, where they say health is not just mere absence of disease or infirmity, it is complete physical, psychological, and social well-being. Obviously, although they didn't specifically talk about brain health, you and me both know that without your brains, you can't basically talk about complete or even partial social and psychological well-being. So I think it is time that we talk big about brain health and put the place of brain where it should be.
Yeah, I mean, that's one of the other things about our brain health campaign. We in MS, we're not just focusing on MS treatments. We're also focusing on the holistic management of MS. So all those things that we know from the general population that impact on brain health also make people with MS get worse quicker. So like smoking, lack of exercise, hypertension, diabetes, all the other factors that are also impact on brain health also need to be managed very proactively in MS. And there's actually emerging evidence now that things like exercise, which we know is probably the most potent disease-modifying therapy available for brain health. This is based on the general population. There is an emerging evidence base in MS that people who do exercise, and it looks like, I hate to say this, but it looks like a hit, high intensity interval training does something very special physiologically in terms of brain health. It looks like HIT has better results than, the WHO have been promoting this, 30 minutes, 5 days a week aerobic, moderate intensity exercise program. It looks like in the MS population, HIT is actually better. I don't really care if people do high interval intensity training or aerobic. They just need to exercise, and it doesn't. And even if they are disabled and they have problems with walking, for example, there are exercise programs that physiotherapists can design for disabled people. So I don't think disability, in my opinion, is an excuse not to exercise. Now, people with multiple sclerosis say, "Well, I get fatigue, then I get temperature changes." Yes, but you can adjust those. You can do water exercise, and also, deconditioning makes fatigue worse. So a treatment for fatigue is conditioning, getting fit. So I'm quite I tell every patient, I ask every single patient I see on my clinics, are you exercising? If they say no, why not? What's the hurdles? Do you need help? Because we've got this thing in the UK, in the NHS now, called social prescribing. So the GPs, for example, can write a prescription for a physical trainer, which is great. Up until now, we haven't had that. It's not universal in the NHS. It's just been rolled out. It's what they call social prescribing. So we have the opportunity now to try and nudge our patients into a healthy lifestyle.
I agree, and I basically tell my MS patients, and I tell this to all other neurology patients also, that you have MS, but you don't have to let MS have you until the last moment. The idea is, again, trying to preserve that total or near total complete well-being as best as possible, isn't it? We can't basically give up.
Yeah, I mean, the other thing about brain health, and I mean, this is not from the MS field, but mainly from the dementia field, all-cause dementia field, is that these lifestyle modifications and all that have to occur in midlife. If you start modifying your lifestyle, when you're over 50, it's probably too late to make a big difference to the trajectory of your brain. You probably will have some impact, but you've got to have. It looks like you have to have the interventions in your 30s and 40s to make sure you make a big difference in terms of exercise, keeping your blood pressure down, not getting diabetic. Because once you've got the metabolic syndrome and you've got to your 50s, and as we know, metabolic syndrome, which I refer to as it's basically insulin resistance. It drives it all. Once you've got insulin resistance, it's probably too late, and you're in your 50s, you've got to. So this is why I think this brain health message, we as a community have to take it to children. We have to take it to adolescents. We have to take it to university students. We have to take it to young adults and say, you've got this precious thing called your brain, and this is what you have to do in terms of looking after it so you can age or get to old age with what I would call healthy aging, and you can define. I personally think we need to have a good definition of healthy aging from a brain's perspective. I know most people think about healthy aging from a joint, from a heart perspective, but we should actually change that and think of it from a brain perspective.
Yeah. I think you hit the nail on the head once again. This is actually happening. One of our former presidents, Vladimir Hachinsky, former editor-in-chief Stroke Journal from Canada, recently wrote a very short correspondence in Lancet Neurology, basically giving us a new definition of brain health, basically pointing out what you just said, that why we need to exercise our brain and preserve brain function as best as we can. I think he is absolutely right. I'll send you the correspondence once I finish.
I would like to. So one of the things you hinted at in terms of being healthy, so there's also this concept of wellness, which is how you interact with the environment and greater society and the planet, for example. And there's a whole lot of wellness practitioners now who understand this. So it's not just about you as an individual and your health, but it's about how you feel about your interactions with society, the planet, etc.
Environmental, animals, the One Health.
And that's something that we have been ignoring, and it's particularly topical because of COVID-19. We had a little bit of breakup there. Back, social determinants of health, in other words, deprivation, ethnicity, poverty, lack of education. These things are, and your social network, how big is we call it social capital, how big are your networks? These are the things that people have just ignored, but there are things we can do about that. There's no doubt that in countries where there's less inequality, they age better. In countries where there's less poverty, people are healthier. So there's all these things that we as a society, not the medical profession, necessarily have to tackle. It's a political issue. But why medical people, doctors, neurologists, can't have an opinion, because at the end of the day, policy or political change happens because of pressure. You build up pressure and you keep harassing your politicians to say, well, we've got to get rid of this inequality. We've got to sort out poor education. We've got to sort out poverty, food insecurity, overcrowding, all these things. And by doing that, that's a component of brain health that hasn't been studied very much. But we know that if you are on the lower rungs of society, you have chronic stress, and we know chronic stress affects the brain. So this is an enormous topic. We could spend hours discussing brain health.
Absolutely. I think you're absolutely spot on. The current pandemic, if we reflect on current pandemic and how we deal with it, when I was telling the rest of the other committee members and MSIS partners in crime also, we could take a leap from the World Health Organization approach to tackle this pandemic. We both agree that this is a global threat. This is third world war, if you like, and the entire humanity is at threat. Whatever that is happening in Africa or India is going to impact in London and Australia within minutes, within days, within weeks. All these variants are the sort of timely reminder. So it is natural that G7 leadership, WHO, wanted to have a global approach, Covishield program, so on and so forth. So my argument is that why can't we have the same sort of approach in brain health? After all, we can now see the future of humanity is relying on two things. One is the behavior of COVID-19 virus, how quickly it is putting up virulent strains, which is basically driven by our behavior as humans, how we practice vaccination program, the social distancing, etc., etc. So if world is together to address that as a global problem, I think we should be addressing the brain health problem in one world also. I know that it is too much to ask, but let's take multiple sclerosis for an example. We have 2.8 million people with multiple sclerosis. We know that we have excellent therapeutics at the moment, almost stop multiple sclerosis, but we also know that 70% of the countries cannot access early diagnosis or treatment. Perhaps it is timely then that we convince the G7 leadership, we convince the World Health Organization or policy changes that come up with some sort of essential medicine list or some way of helping people to access the early diagnosis, access some way of equitable treatment. And then the more overarching global theme of brain health that you and we were talking about, One Health, environment, so on and so forth, those things we can educate. At the end of the day, if we have decent brains running this world, decent brains running this world's media, decent world running the sports networks and art and rest of the other things, we would be more environmentally friendly and the humanity would be flourishing, wouldn't it?
Yeah, so we're getting really political, but yeah, I agree with you. And also, I've already created an essential disease-modifying therapy list that I think could be used in low and middle-income countries. The problem with that, it's a bit of a double-edged sword because you don't want to disincentivize the pharmaceutical industry too much because they're part of lifting low and middle income countries up as well. They're part of the economy. But I think, when you've got so many untreated people with multiple sclerosis, just like in India, for example, because of the size of the country, there are more people with MS in India than in the UK. And I'm aware only 2% of people with MS in India are on a DMT. And we have good evidence for these unlicensed therapies that they do work. So there's no reason, I think, in India for somebody not to be on one of these affordable generics, for example. The problem, though, we have is a lot of the Indian neurologists are a little bit reluctant to prescribe them because they just don't feel comfortable. They're not supported. And they also think that by using them, they're second rate because they haven't been licensed. The reason why they haven't been licensed is not because they're second rate, it's because these drugs are often off patent and nobody's going to invest in these. Just give you an example, rituximab, which is one of the therapies that clearly works in MS, and it's now off patent and they're relatively cheap biosimilars. it's better than not putting somebody on treatment. So I think we as a community have to, develop a two-tiered. I know it's a two-tiered system, but at the end of the day, our heart's behind treating people with MS. So I'd rather have somebody on an off-label generic that's cheap, affordable for them, treating the MS than not being on a treatment. That's I think the question we have to ask ourselves in those countries. Anyway, there's a lot of initiatives happening to try and get the WHO to put MS drugs on the essential drug list, medicines list. There's lots of things happening to try and promote access to these therapies all over the world. So I think that's part of, I haven't thought about that as being as part of the brain health campaign, but it is part of the brain health campaign, because at the end of the day, it should be treatment for all.
Yeah. Absolutely. Absolutely. I think you touched upon the several important areas. I could drag this interview for hours and hours, but we have to move on. We both have other things to do also. I know that you are about to go on leave, which is well earned in not too long to go.
Well, I've got. We may go because the whole family have got to have. We've got to have we had our PCRs done 2 days ago. We are waiting for the results, but we also got to have a lateral flow test this evening. And if if one of us are positive, we've got to stay at home. So this is the reality of going to. We're going to Greece. This is the reality of trying to go on holiday during COVID-19. Most of my colleagues and friends think we crazy even trying it, but we thought, let's give it a go.
We have to live our life. I agree. I'm in line with what you say, and I wish your PCR test come back negative with all the sort of credit to all the good work that you have been doing. Fingers crossed.
Right.
And I just want to say one thing on something that you mentioned about industry. I think it is important to mention here that we should not look at industry from negative point of view, as you correctly pointed out. It is all about synergy. And when we began our Brain Day campaign 8 years ago, I smelled that our idea is mobilize the whole workforce, not only neurology trainees, medical students, allied health students, nursing students, anyone that we can mobilize, talk about brain health is value for us. Similarly, again, COVID-19 is a perfect example. We wouldn't be having vaccine if not for the industry. It's not purely coming from government budget, as you both know.
Yeah, I mean, industry gets a lot of bad press, and I'm not surprised. But I mean, what you got to realize is that we've created this beast called big pharmaceutical companies, and to be honest with you, the risks of drug development and the costs associated with drug development are so high that you can't do it outside of industry. So it is a partnership. A lot of the basic science happens in universities, also in industry, but a lot of it happens. We pass the technology on to companies, they develop it. I mean, to be honest with you, we wouldn't be where we are today in terms of looking after MS without the pharmaceutical industry. And I think that's a partnership. Absolutely right. And we have to acknowledge that it is a partnership, and you're absolutely right. Goodness me, those RNA vaccines are an example. The technology was developed in universities and NIH in the United States. The technology was transferred into the pharmaceutical industry, either by spin-offs and partnerships with the big companies. And then we had a vaccine, and those vaccines now, the RNA vaccines, are probably going to change vaccinology forever. I can't see us doing anything else but using the RNA backbone for future vaccines. So, this is a real success story. Somebody's got to celebrate this at big time.
Absolutely. I mean, we shouldn't forget that if not for successful vaccine, this could have been the end of humanity or human civilization, basically. You only need the virus to become super virulent, and then that is the end of us, basically. So I'm sure that it is not going to be the case. I'm very optimistic. I think we will win this battle, and we would come good at the other end. My last question, Gavin, is what do you want to say to the youngsters that are out there? I want you to think of people in sub-Saharan Africa, people in most remote parts of Asia, Latin America, North America, wherever they are, those youngsters that are sitting there, what is your advice to them to get the best out of their brains to preserve and promote brain health globally?
Yeah, so I think we're sitting at a. I mean, we're in an era that we have unpacked biology, or we're unpacking biology at a rapid rate. So we're learning so much about how the body works and how the brain works. Okay, and so the future is going to be incredibly bright for treating enormous numbers of neurological conditions. You know, MS happens to be one of the diseases where we've had disease modification, but we're now moving into genetic diseases. You know, spinal muscular atrophy, we've got gene therapy, we're going to have therapies for Alzheimer's. So it's a really exciting time, but that doesn't get away from the fact that these diseases are modified by aging mechanisms. And that's the message I've got to get across. The brain is like a physical structure. Unless you don't, you've got to exercise it and you've got to look after it. So I think people have got to engage with what they want to do with their lives. And there's no better feeling if you're a runner or a sportsman feeling fit. It's the most incredible feeling. And I think the same thing applies to the brain. You know, if you look after your brain and you exercise it and you appreciate the value it gives you as an individual, then you will look after it. Okay. The things we do not to look after it, you know, so things like playing sports where you get head injuries. I mean, we should ban head injury. You know, boxing, for example, I wouldn't recommend it to anybody. Smoking, you know, excessive alcohol consumption. So all of these things that we've know about, you should probably think carefully about your behavior and how it impacts on your brain and what it'll do for your brain when you get to old age. But saying that, though, I would encourage them to go and study, you know, get into science, study neuroscience. If they want to do medicine, study neurology and make a difference. But also you got to realize is we as neurologists are looking after the consequences of these diseases or poor brain health. A much more important thing is to get into politics or get into behavioral psychology or something like that that can actually help society improve their brain health. There are lots of careers now developing in that area.
Absolutely.
Just do it.
Absolutely. And I would also add, be nice to each others and be kind to each others and be compassionate to each others, certainly during these tough times. It is a good thing for your brain. And your brain is the central processing unit of who we are. And we all know that what would happen to a computer when the CPU goes, and we don't want the brain, the CPU to go by any means. Gavin, thank you so much for giving us time, and we wish you all the very best. And keep an eye on our Twitter chat on the coming days. If your family allowed you to get onto social media while you are holidaying in Greece, Professor Gavin Giovannoni, thank you so much for all the hard work and good things that you have been doing over the years. And we look forward to seeing you face to face back again in Melbourne. Or any other city in the world once we come out of good at this pandemic. And keep up the good work, stay well and safe, and have a good break while you're in Greece. Take care.
Okay.